a lot of women who have pregnancy complications, or who might be at risk of postnatal depression or mood issues, they feel, look, I've enough going on, really, I feel it's easier for me to not to breastfeed and to feed the baby formula milk. So I think when they and some of these women might be delivered preterm because they had blood pressure problems, they had gestational diabetes, they had other complications. So you can understand that there's a lot going on. They might be on medications themselves. But I find they're quite surprised when I say, well, look, have you thought about breastfeeding? And then when I enumerate the benefits to them personally in terms of reduction in cardiovascular disease and diabetes, and many of these women might have extra weight, which would put them at risk for those conditions as well. I think they're quite surprised to hear that, and that is another motivator for them. So I think it's offering the women information, motivating them. Now, we do know that the decision to breastfeed is often taken during pregnancy. So you're absolutely right. During pregnancy is probably the time to introduce the topic and for her to consider it and for her to support her. So I think that information early in pregnancy, during pregnancy, so she's mentally preparing to breastfeed. I think that's a crucial time. We do know that women, their intention to breastfeed is a very strong predictor of them successfully breastfeeding. So I think as healthcare providers, there's a lot to discuss in pregnancy. I appreciate that. But I think the evidence would suggest that those conversations in pregnancy are very important. And we do know that patients, they will listen to their healthcare providers, to their obstetrician, to their general practitioner, to their midwife. They will hold a lot of weight from those conversations over and above perhaps other sources of information. So I think supporting women to breastfeed, introducing the topic. Of course, breastfeeding can have its challenges. It's not doesn't work out for everybody. There can be a lot of work and support required. So I think knowing those extra benefits to them personally, I think will help them continue to breastfeed if they overcome challenges. And also it allows them to discuss with their family if they're struggling with breastfeeding, and perhaps some members of their family feel, well, look, is this working out for you? Then she can say, well, actually, this will help reduce risk of diabetes, improve my mental well-being. So it'll equip her really to have those reasons and to bring in people around her to support her. So I think introducing the topic in pregnancy is really a key. There's a lot happening around the birth, and I think not leaving the decision to that stage. I think it would be better if we can introduce it in early pregnancy.